All right, well, we'll go ahead and get started. Thanks everybody for joining in today. Even though this reunion is being held in 2022, this was actually planned in 2020, as many of you know, and unfortunately had to be canceled then and then rescheduled in 2021 and then canceled then. And so this year we said this is going to happen. So we're glad that it is. So thanks everybody for joining in. I'm Scott Baker. I'm the director of the survivorship and the Pediatric Blood Marrow Transplant Program. And I'm sharing this presentation today with Neil Bhatt. Neil is also one of the pediatric BMT physicians here and works in our BMT survivorship clinic, and also has started a new clinic for adult survivors of childhood cancer. And I'll tell you a little bit about those clinics as part of the presentation as well. So you can go to the next slide. So today we're just going to give a brief overview of late effects. We'll talk about some of the specific complications that are seen after blood and marrow transplant. And then Neil's going to talk more about really the importance of survivorship care for our pediatric transplant survivors. Next. So survivorship after blood and marrow transplant is a pretty complex topic, and so we are, only going to kind of touch the surface here today. And I want to just mention that the slide set that's going to be available to everybody after the presentation includes some slides that we're not actually going to have time to cover today. So there'll be a bit more information actually in the slides you'll have available later. But blood marrow transplant is used to treat leukemias, several other cancers, and also importantly, non-malignant diseases such as sickle cell anemia and immune deficiencies. And survival after blood marrow transplant has significantly been increasing over the last several decades, really making survivorship even more important. Unfortunately, for some individuals, the treatments associated with transplant can lead to side effects which can last for many years. And children are at higher risk because of receiving the intense treatments at young ages, and then followed by years of expected growth and development into adulthood and actual survival for decades. So it's important to recognize what some of the potential side effects are and how we can prevent them or possibly even treat them. Next. So when we look at long-term effects in our transplant survivors, there's sort of 5 buckets that these fall into. The first one is already shown here, including issues related to growth and development. And so this can be problems with linear growth, just how tall a child's going to be after transplant, problems with skeletal maturation, intellectual function can be impacted by transplant, as well as emotional and social maturation, and importantly, sexual development as well. The next. And then there are several vital organs which also can have complications in our long-term survivors. And a few of those are listed here, and some of which we'll talk about, including cardiac problems post-transplant, issues related to lung function, renal or kidney function, a variety of different endocrinology type effects, GI, so liver and stomach and intestines, vision, hearing, and dental as well, which isn't listed here. Next. And then there can be impacts on fertility and reproduction, which are also very important in our pediatric survivors. And also the potential risk of new cancers developing after transplant, both benign and malignant cancers. And importantly, overlying all of this is that we really have to pay attention to the health-related quality of life of our survivors as they age into adulthood and really throughout adulthood. Next. So I'm going to go through some of the major organs that we pay closest attention to. And the first of these listed here is heart health. And so we know that our transplant survivors have an increased risk of the cardiac conditions shown here. The first being cardiomyopathy, which is actual damage to the heart muscle itself, and that impacts heart function. The next is valvular heart disease. So the valves in the heart can be impacted by transplant, primarily by radiation, however. And then there's a higher risk of developing coronary artery disease, which leads to heart attacks. There can be problems with the rhythm function of the heart, development of arrhythmias. And then one of the more common things is development of what we call metabolic syndrome, which is really a combination of high levels of cholesterol, high triglycerides, obesity, and also can be associated with high glucose levels and even the development of diabetes. And all of these factors can also increase the risk of developing heart problems. So the risk factors in terms of heart health are primarily related to chemotherapy exposures, including anthracyclines. And anthracyclines are used commonly to treat most forms of leukemia. And so this is actually a treatment exposure that's occurring actually prior to the time of transplant. Alkylators are just another class of chemotherapy drugs that are commonly used during the transplant conditioning regimen. And then importantly, radiation can have an impact on heart health as well. And we also, can't forget the impact of lifestyle. So just like in the general population, our heart health is really very heavily dependent on diet and exercise, avoiding substance abuse and other factors. And of course, genetics come into play here as well. And I'll just point out, when you look at the other presentations today, the track 3, you may want to listen to that or get the slides from it, which is really dedicated to exercise and physical exercise related to importance of developing heart health. Next slide. When we look at screening and treatment for heart problems, from a screening standpoint, this is really based on the dose of chemotherapy, particularly the anthracyclines and radiation that a patient receives. So the risk is really dose dependent, with, of course, the higher risk being associated with higher doses. What we recommend is that our survivors receive an echocardiogram, the heart ultrasound test, every 2 to 5 years, with referral to cardiology if there's any abnormalities that are identified. It's important that they also receive assessment, including lipid profiles and fasting glucose levels, and those should be checked at least every 2 to 3 years. And then, of course, assessments of weight and blood pressure should occur at each follow-up visit as well. And when we look at how to modify the risks for heart problems and cardiovascular disease, the two most important things are really, eating a balanced, healthy diet, and then exercise, is also really critical. Obviously, things in terms of avoiding smoking and limiting alcohol are beneficial as well. Next. The next topic is really related to endocrine health. So endocrine problems are actually very common in children after transplant. One of the most common is what we call growth hormone deficiency. Growth hormone is responsible for our normal development of height. And so deficiency of this hormone can affect the ultimate attainment of adult height. It also can have an impact on bone development and the actual age of bones. Thyroid dysfunction is very common after transplant, and it can be either hypo or low functioning, or hyper or high functioning thyroid, as well as potentially thyroid cancer. And it's important to know that thyroid dysfunction can develop very early after transplant, or it can actually happen, many years after the transplant. And the signs of thyroid dysfunction are incredibly vague. They can be fatigue, cold intolerance, weight gain, headache, trouble concentrating, constipation, dry skin, or importantly, patients can develop hypothyroidism really without having any symptoms at all. And so the laboratory screening tests are really important for this. And then the third major endocrine system that we pay attention to are just related to gonadal hormone deficiencies or sex hormone deficiencies. And so these can affect development of puberty as well as fertility. And the biggest risk factor in terms of endocrine health is really radiation. And so total body radiation that we utilize in some patients during the transplant, and then potentially other radiation to the brain. Some leukemia patients with leukemia in their spinal fluid receive brain radiation, and that further increases the risks of some of these endocrine dysfunctions. Next slide. So screening for these, fortunately, is very easy. Most of them are blood tests. As I mentioned, our pediatric survivors should really have their thyroid function checked annually if they've received TBI with the transplant. And then it's important that they really be closely monitored for growth, and importantly, the growth velocity. And this really should be occurring every 6 months. And in patients who we notice that their growth begins to level off, or their growth velocity begins to level off, that we actually refer them to endocrinologists for formal growth hormone testing. And bone age is another study that can be obtained to look at the age of bones, which sometimes can either be ahead of chronologic age or lag behind chronologic age. And then, of course, monitoring for pubertal development is important. And if there's any concerns about pubertal delay, then checking gonadal hormones. These include LH and FSH, and estrogen for females and testosterone for males. Again, so these are very easy to monitor and really should be paid close attention to. And the risk modification is really, just as I just mentioned, close monitoring of all of these and treatment of any of the hormone abnormalities, because fortunately there are good treatments for all of these endocrine problems that can develop. Next is bone health. So there's two primary bone health issues that we deal with in our transplant survivors. The first is called avascular necrosis. This actually is a complication that generally occurs earlier in the course of post-transplant follow-up. And it's actually sort of as it sounds, almost like death of the bones close to the growth plates, can cause significant pain and ultimately can lead to the need for joint replacements. And then the other main thing is low bone mineral density, so either osteopenia or osteoporosis. And the pictures on the right just show you examples of what normal bone looks like, and as bone begins to thin, what it looks like. And then you can see just in the osteoporotic bone on the far right, how much decreased bone mass there is there. The risk factors from a bone health standpoint really are related to exposure to radiation, steroids, all forms of steroids, low gonadal or sex hormones, early menopause in females, and growth hormone deficiency. Next. So the screening for these bone problems is really based on DXA scanning, and there's a picture of a DXA scanner down there on the right. And so you can just see in the graph there, the computer program in this DXA scan can determine what the bone density is and plot it on a graph where in the green bars, that's normal bone density. As the bones begin to have less density, they can fall into the lighter green or yellow range. And then if there's actually osteopenia or osteoporosis, they'll show up in the orange and red range there. Fortunately, there's many things we can do for kids with low bone mineral density. And the two most important things are really treatment with vitamin D and calcium. And so we're routinely doing this during transplant now, looking at these levels pre-transplant, supplementing the kids during transplant, and then monitoring them post-transplant as well. However, for some patients, the calcium and vitamin D alone is not enough to prevent or treat loss of bone mineral density if it has developed. And so there's a class of medications called bisphosphonates, and pamidrodate is one that we use most commonly. Those are actually medicines that are used to treat osteoporosis in adults as well. They just help the body build back bone density and strength, and are very effective in kids as well. And then, of course, if there are any hormone deficiencies that are contributing to osteopenia or osteoporosis, then replacing those hormones will be important as well. Next. Kidneys are one of the organs that we also follow function on a long-term basis. And importantly, early kidney injury can actually lead to long-term diminished kidney function. And the risk factors are multiple. Obviously, exposure to chemotherapy and radiation are two of the primary ones, but also other medications that we use during the transplant process, including several of the different antibiotics. And then, unfortunately, the graft versus host disease prevention medication like cyclosporin and tacrolimus also have an impact on kidney function. And so these are the risk factors that we look for. Next. So when we screen for any problems from a kidney function, it's really important to do this on an annual basis. And so there are blood tests that check kidney function, primarily the creatinine level, very easy to do and monitor. Looking at urinalysis to look for any evidence of protein in the urine or blood in the urine. And importantly, blood pressure monitoring is very important. So the kidneys are one of the primary regulators of blood pressure. And so blood pressure monitoring or high blood pressure can potentially be also a symptom of kidney dysfunction. And then of course, reviewing medications. Are there any medications that the kids are on that can still impact kidney function? And in terms of risk modification, obviously we want to avoid medications that are hard on kidney function, and we try to do that whenever possible. As it is early post transplant, it's also important later post transplant to stay well hydrated. The kidneys, really like us to be very well hydrated. And then if there is evidence of high blood pressure, making sure that blood pressure is well controlled. Next. And then lung health. So about 10 to 15% of patients after transplant will have delayed or chronic pulmonary complications. These late onset lung complications, however, are really strongly associated with chronic graft versus host disease and some of the natural response to the lung injury that chronic GVH can cause. So the primary risk factors are really the development of acute and subsequently chronic graft versus host disease. There is some risk from radiation therapy to the chest, although the doses have to be quite high for that and likely quite higher than what we use in terms of total body radiation. Then there are some chemotherapy drugs that do have some pulmonary toxicity. And so busulfan is one of the drugs that we commonly use during transplant, and it can have some impact on long-term lung function as well. Next. So from a screening standpoint, a lot of it is really symptom-based. So screening for symptoms of cough, shortness of breath. We can do pulmonary function tests, which we routinely do post-transplant and continue to follow those if they're abnormal. And then sometimes chest imaging, either chest X-ray or CT scan of the chest is done if there's symptoms that are present. And from a risk modification standpoint, not surprisingly, avoiding smoking, vaping, or illicit substance abuse. But importantly, just close follow-up if there's any pulmonary function testing abnormalities or symptom changes that develop over time. And I'm going to switch over and let Neil do the second half of the presentation. So Neil, go ahead.
Thank you, Dr. Baker. So I will next share some of the complications that can affect neurocognitive function and also psychosocial function after transplant. So neurocognitive abnormalities can also be a long-term sequelae among survivors of blood and marrow transplant. And these complications can be subtle and can impact memory, attention, processing speed, and even IQ. And they're often difficult to diagnose and can sometimes manifest as behavioral changes or problems with school performance. The risk factors for these complications are chemotherapy exposure, also specifically radiation exposure, and also in general other medications and overall transplant experience and complications that occur after transplant. Specifically, the exposure to total body radiation and the timing of it can be associated. So if patients have been exposed to radiation at early age and school ages, they could be having some significant complications associated with their neurocognitive function. And similarly, the exposure to central nervous system radiation can also be one of the risk factors. So in terms of screening for neurocognitive abnormality, we recommend that patients get formal neuropsychological testing. And I would encourage all of you to listen to Dr. Goldberg's presentation, where he talked about the neurocognitive issues in much more depth. That was a breakout session right before ours. And it can provide some information about what they exactly look for and how this neurocognitive dysfunction is identified. It is also important to rule out any problems related to vision or hearing that could be causing some issues with school function and behavioral changes. And then also in general, it's important to rule out any brain changes that could be causing this side effects of neurocognitive challenges as well by doing MRI. Next, I want to talk briefly about fatigue. So that is also an important challenge for survivors, and it is defined as distressing or persistent subjective sense of physical, emotional, and or cognitive tiredness related to cancer or its treatment that is not proportional to activity and interferes with usual functioning. And for fatigue can be seen even months to years after completion of therapy, and it can persist. And usually it shows up as just weakness, exhaustion, lack of energy, or daytime sleepiness. And the risk factors for fatigue are also overall transplant experience, including the medications that are being given, along with stress, pain, sleep disturbances, or nutritional problems can also be some of the side risk factors. In terms of screening for fatigue, it's usually hard to screen or manage. So we often recommend that survivors keep a diary to keep track of the symptoms. Also, assessment of pain, emotional stress, and sleep disturbances, which can be triggers for fatigue, is also important. And also formal physical and or occupational therapy evaluation should also be considered. In terms of management or risk modification, it requires a multimodal approach, including ensuring adequate nutrition and hydration, and also proper sleep hygiene. And then expressive and or complementary therapies such as support group, counseling, breath control, muscle relaxation, even yoga and meditation are also helpful. Energy conservation should also be considered, and then exercise is also very important. In terms of discussing emotional health of survivors, patients are at risk for developing body image concerns after completion of therapy. Also anxiety, depression, and post-traumatic stress can also be seen. And then fear of disease recurrence is also a big issue after transplant. There are several risk factors for these complications as well, but most importantly, graft versus host disease and its treatment, especially steroids, are most relevant. And then regular screening for symptoms should be performed using various different tools that are available, including patient-reported outcome measurement tools. And we recommend that the regular assessment of by licensed professional should be performed, and then sometimes peer support and relaxation and expressive strategy can also be helpful for management of emotional health issues. Next, I want to talk about a return to school, which is not always on the mind of patients and their caregivers after completion of therapy, but we have noticed that that can also be a huge issue for patients after bone marrow transplant. So we all know that schools play an important role in children's development in terms of their cognitive and emotional growth, and also for social development. And children who are undergoing bone marrow transplant are out of school for a prolonged period of time because of the risk of infection, and also while they are coping with their post-treatment sequelae. However, after prolonged absence, when patients return to school, it can be helpful in terms of getting a sense of normalcy for them. Also, they can feel like they're back being in control again. Also, it can be a self-esteem boost for them, and also social support. But it can also be a huge challenge, and there are several factors that impact this return to school experience, mainly the underlying diagnosis and the treatment exposures. Also, patients' age at transplant. So if they're being treated with radiation or at a younger age at transplant, they could be having significant difficulties while returning to school. And also just previous school experience, how their performance was in school prior to return to school, and also what type of school they are returning to, public versus private, and what sort of support the schools can provide to the patients. Um, there is a lot of support patients need from all the stakeholders who are involved in this process to make sure that they have a good, successful return to school experience. So from hospital team, they need support in terms of vaccination, ordering neurocognitive testing, referral to physical therapy, occupational therapy, referral to psychology as needed, and also communicating with school in terms of what a patient's treatment has been and how that can impact their school function. And from school team, they need support in terms of setting up an individualized educational plan or 504 plan to support their physical and cognitive late effects, and also having regular communication with healthcare team and family to make sure that everything is going well, and how to ensure that patients' academic success. And also they can be helpful in talking to the students' peers to make them understand patients' diagnosis and avoid any concern for a potential bullying. So as we have discussed all this complications that can happen after transplant, next I want to briefly talk about the importance of survivorship clinic visits and how it can be helpful in not only preventing and diagnosing these complications, but also managing them. So these visits are helpful for regular screening of these late effects and early detection, and which can lead to potential intervention. There are even certain late effects that can be reversible if detected in time. For example, the cardiovascular late effects, and then also treatment for growth hormone issues can also be reversed if detected quickly. The need for follow-up is lifelong, because these issues can emerge even many years after transplant. So this journey does not stop at cure. At Fred Hutch, I want to show very briefly what sort of support we can provide for a pediatric BMT survivorship. So we have a pediatric BMT survivorship clinic where we see our survivors longitudinally for thorough assessment of their disease control, graft versus host disease. We also support their vaccination and measure their titers to make sure they are immune against different bugs. Also, we evaluate their organ function and also refer the patients to various subspecialties as needed. Additionally, we also have an adults survivorship clinic, as Dr. Baker earlier mentioned, where we transition patients who eventually become adults and for their ongoing longitudinal follow-up. And here we provide patients with a detailed treatment summary and care plan, which can be shared with their primary care doctors, and also counsel them for their long-term health risks and ensure ongoing organ function evaluation. So as I mentioned, one of the things that we do during the survivorship clinic visits is providing a treatment summary and care plan to patients. So it's a 4 to 5 page long document, which includes details of patient's diagnosis, including the type of disease, stage, and then age, and all the specific information. Also list of care providers who are involved in patient's care, and including their contact details. We also provide details on treatment, including specific doses of the chemotherapy agents and also radiation doses. And then provide a list of complications that have occurred while patients were on therapy and also after completion of therapy, and their significant potential implications on patients' health. And then lastly, we provide recommendations for follow-up evaluation. So this document is very comprehensive and includes all the information that patients and their healthcare providers need. So they know exactly what patient has been through and what needs to be done moving forward. So with that, I would like to summarize and I have listed a few take-home points here, that blood and marrow transplant survivors are at risk for developing a wide range of long-term complications. And these complications can affect patients not only physical health, but emotional and intellectual health as well. Regular follow-up of patients with survivorship clinic team and primary care doctors is needed for prevention, early detection, and mitigation of late effects. And then treatment summary and survivorship care plan can be a helpful resource for patients and their healthcare providers. Here are some of the resources where you can get additional details on the topics we have discussed today. We'll make these slides available so you can access these links afterwards at your convenience. And with that, we'll be happy to take questions, and thank you for your attention.